Okay, guys, please, if you see me now on the Facebook Live, please, guys, let me know. Thank you very much. And I hope things clear and there is no any echo. Let me double check this from my side. Tuesday, that's what we call it because we discuss clinical cases and the Great Tuesday. Okay, guys, I just checked this on the Facebook. Okay, guys, I'm still looking for the Facebook Live to check if I'm live right now on the Facebook. I'm live, but I mean on the Facebook. Okay. Also Zoom. Let me check on Zoom as well. Okay, that is great then. Okay, that is great then. Let me share my screen for the mock. This is the mock. Let me share the mock right now. Zoom. Share link. Okay, this is the mock right now. Okay, guys. Let me just discuss with you a little bit about really how much I'm proud with you guys in this mock. I'm really, really, really proud of you guys because while I was making the mock, I tried to make it really tough. Tough the way that will be simulating the ADC exam. So I hide somehow the answers between the words, and then the dental knowledge and concepts was the updated knowledge and concepts based on the recent ADA articles or things that mostly the candidates, they really not look after them. And then also it was clinically based, same like ADC exam. It has lots of critical thinking, and I didn't expect at all this is going to be the result. I was expecting the result will be really bad. Because these are the type of questions, as I told you before, explained this to you before. Exam has different types of questions, different levels. There's every exam in life in this way. It has simple questions for everyone, average questions level. This is for average people. And then the toughest question, that's only for really the candidates, they're going to pass the exam. So to make 100% of the exam tough questions, and I see that's guys who scored high in it. I feel really very happy and proud of every one of you. That's why I really, guys, would like, okay, let me first to say congratulations to these candidates. I will call them really fighters because I don't know how they scored that high. Dr. Ati, she scored 92%. Dr. Nevia, she scored 88%. Dr. Helen, 88%. Dr. Itken, 88%. Dr. Charo, 88%. Dr. Suman, 84%. Dr. Nega, 84%. Dr. Bina, 84%. Dr. Luciano, 84%. And Dr. Hani, 80%. So guys, I would love and I would be happy, very happy, if you guys congratulate these candidates at this stage right now, and also congratulate yourself because I have seen most of you guys have scored very high, which is something surprised Alpha, something which is surprised even Alpha team because they didn't expect it as well. Okay. Okay, guys, before I start, I was very happy to announce this because you motivate me to work even more and harder. And that's why even we're going to have also the new course start this Monday. And the new course, it will start for the candidate having exam in March 2026 and September, but definitely many will be for March, and this is going to be bonus for September candidates. They can start the preparation now. So guys, I would love to say hi to everyone. Hi, Dr. Taslim. How are you going? I love to check on every one of you guys. Hi, Dr. Walija. How are you going? Dr. Lev. How are you going? Dr. Vishali. How are you going? By the way, part two result as well. We are very happy with our champions. I believe we have up to 3 champions passed so far. And then I'm posting for them one by one because actually it was a very busy day for me. I posted a lot for other things. So I will be posting once I get time again. Dr. Vishali, how are you going? Dr. Musa, how are you going? Dr. Sangita, how are you going? Dr. Arslan, how are you going? Dr. Tanvir, how are you going? Dr. Leyu, how are you going? Dr. Srisha, how are you going? Dr. Dimple, Dr. Srisha again, Dr. Ashwani, Dr. Amolia, Dr. Kawalji, Dr. Melzima, Dr. Fatima, Dr. Alifeh, Dr. Teresa, Dr. Anum, and Dr. Sumita, and every one of you guys. Can I get the details? Okay, Dr. Arslan, please, if possible, you can talk to, you please can talk to the admins. Dr. Arslan, you can talk to the admins. Please, admins, if possible, send the link to Dr. Arslan. The course will be starting this Monday, Dr. Arslan. The new course. Hi, Dr. Kelvenda. Dr. Taslim, I scored 84 as well. My name is not there. Oh. I need to talk to Alpha team then to find out why it's not there. But a special congratulations to you, Dr. Taslim then. Special congratulations to you. Yes, Dr. Teresa, because there are more candidates that scored 80 as well. So congratulations to you, Dr. Teresa, as well. Okay. Okay. Okay, guys, let's get this one then. Okay, so guys, thanks guys for all of this, and then let's start right now. Guys, by the way, how was the mock? How did you find it? Interesting, amazing. I'm very happy, guys, to hear this. You scored 88, Dr. Natasha. Wow. Okay. Maybe this result has been taken in the first day, maybe. Right? Maybe that's a reason. Okay, that is good then. We're gonna go and guys see this, but it was very good. I'm very happy. It was eye opener. Need more tougher mocks like this? Okay, I will do it, guys. I'm very happy to hear this. Scored 80 was great. Hi, Dr. Patel. How are you going, Dr. Patel? Okay, good. That is great then. Let's start answer the mock right now. As it looked rough, but after getting good score, now can I say it was easy? Very good. I'm very happy to hear this. 64 is very good, guys. Okay, let's start. I hope guys, every one of you go. If I hope every one of you guys motivated to answer this mock. Okay, guys, deep breathe, pen and paper, and only 13 weeks left for the exam. We need to focus every single minute. It does count right now. Now, the question, what is the most appropriate immediate management? What they got the answer here? A, B, C, or D? Which one? The dentist. So what has happened is, after about 45 minutes of treatment with another patient waiting outside, you began preparing to irrigate and temporize the tooth while using the last file for today in the mesiobuccal canal during the final minutes of the appointment. The file separated inside the canal. A periapical X-ray was taken. This one. The patient immediately says, please finish everything today. I cannot come again this week. So guys, what do you think the right answer then? Let me check right answer. See, Charlie? See, Charlie, Dr. Trace, see, Charlie, Dr. Shivat, see, Charlie, Dr. Fatima, see, Charlie, Dr. Debika, E echo, okay. Dr. Raza, see, Charlie, Dr. Singh, see, Charlie, why not E? We're gonna check this, Dr. Na, right now. C and E, so mostly now the answer between C and E. Let me check about E, C and E. Now, C. What is the most appropriate immediate management? A. Attempt ultrasonic removal of the fragment immediately. That is dangerous. This is really dangerous. This is dangerous to just start with ultrasonic. You may start with ultrasonic, but not now to remove it. Maybe to increase the access to the canal, right? To make a purchase point for yourself to remove the file from inside, the broken file, but you cannot remove it with ultrasonic. That will be crazy. Bypass the fragment and complete RCT today. This is wrong. Why? Because it's not safe enough. Because there is a patient outside. Think about it clinically. A patient sitting outside. You are in rush. You're going to be under pressure. You will not be able to do any treatment. Even if you decide to treatment, you will not feel happy. You will feel under pressure. You're going to be in rush. And then you're going to end up with perforation. You're going to end up with breaking more files inside. So you must have clear mind. You must explain situation to the patients first. And then after this, with clear mind, you can remove the file. So B is wrong. Disinfect the canal, place calcium hydroxide, later mix 50%, temporize and reassess. This is the best option. Why? Because we need to ensure the canal is nice and clean. Calcium hydroxide, which is going to kill any bacteria inside because there was an infection down there. The scenario for infection. Later mix for any inflammation because the diagnosis is chronic apical periodontitis. How did I know this? I know it from the signs and symptoms provided. Because the tooth is asymptomatic. What does it mean by asymptomatic? Means a chronic. It is chronic condition, symptomatic chronic. If the tooth is symptomatic, means painful, it means it is acute. So now it is chronic condition, right? And then it does say mild occlusion, showing discomfort and tender to percussion. If the tooth has mild tenderness, means the periapical area has inflammation in it. That's why it is chronic periapical periodontitis. So this is my diagnosis today, right? Okay, now let's see. His medical history is clear and reports occasional smoking, social drinking. He works wherever limited, wherever. About 45 minutes, this all happened. Okay. Now, close to the pulp. The tooth is symptomatic, only mild. Okay, discomfort, tender to percussion. His medical history is clear. Occasional smoking, social drink. He works full time. Has limited availability dental appointment. Fine. So, diagnose based on signs symptoms. Diagnosis based on signs symptoms is there is inflammation around there, something wrong going down there. But looking at the, you see, guys, that's why always it's tricky. It's very tough, no easy exam. Looking at the foot, the radiograph, you will see there is a radiolucency down there. And Bedo bites. Sorry, this is Bedo math. Bedo's math. Radiolucency on X-ray, or I would say periapical radiolucency on X-ray equal to infection. If you see periapical radiolucency means infection. So now there is periapical infection going there. That is chronic periapical infection. E, disinfect place leather mix only. No, when we have an infection, we need to use calcium hydroxide because this is the best for infection. Calcium hydroxide is the best for infection. And leather mix has been placed because the patient has mild tenderness. So calcium hydroxide for infection, that's what I can see from the photograph. And then leather mix for inflammation because the patient has tenderness. So the answer now is C, Charlie. Next. How should you handle the patients insisting that you finish today? What do you think the right answer? A alpha? I see, guys, most of you provide A alpha. Also, infection, don't give only, no, depends how severe the infection. Because chronic, in this case, we can use calcium hydroxide. Acute infection, calcium hydroxide cannot be used. So calcium hydroxide used when it is chronic infection. In case for acute infection, don't use calcium hydroxide. So now, A alpha is the best, straightforward. Explain the risks, decline unsafe treatments, and schedule a second visit. Some people get me mistaken here. They say, doctor, but he's actually doesn't have time to come back again. And he says, please finish everything today. So should I complete the treatment today? No. Even because the patient gave consent? No. Why? Because you're going to end up with too many complications. So that's why it's not recommended to do any treatment today, but you need to explain the risk to the patient. So the answer is A. Perform extraction. It's very aggressive type of treatment. Don't do it. Refer immediately to endodontist. No need, because still you can, as a general dentist, it's your scope to remove the broken file. Prescribe painkiller only. Not really good option at all. What do you think, guys? The answer for question 3. Which statement is the most appropriate communication? Which one of these do you think it is the best to communicate with the patient to explain what's happening? I see the answer C, Charlie. C, Charlie. C, Charlie. Very good. C, Charlie. Okay. Okay, see, it's C, Charlie. The first option, I cannot finish because there is a patient outside after 5 minutes. Very rude. This is not assertive, nice way at all. This is very rude. Your tooth is too complicated, and I should refer you to specialist. That's not right. You still can manage the tooth by yourself at this stage. Finishing today would risk further damage. The safest option is a staged treatment. That's the best. And be honest with the patient. Always be honest. Don't never ever let the patient to put you under pressure or under stress. Because once complications happen in your practice, the patients will only blame you, never blame themselves. They say you are the dentist, you understand you understand what are you doing. You should have told me. That's okay, but I told you. No, but you need to insist. You should have refused. So that's why C is the best. That's okay. I will be doing the treatment today. No. That's okay. I will ask the next patient to wait for 10-15 minutes. Not enough. Not enough, and also you're going to be under too much pressure. And not good as well to ask the patient. It can be if it's emergency cases, but this is not an emergency case. So answer is C, Charlie. Next question, please, guys. What additional and significance measure you should take after the file separation? I'm sure, guys, most of you answer this question wrong. E-echo? That's a good one, seems like. E-echo, right? Very good. E-echo, you see? Everyone, guys, answered E-echo. A stage like another visit. We need another visit, or maybe more than one visit. E-echo, E-echo. Most of you guys go with E-echo. A surprise. A surprise because the answer is A alpha. You see, guys, mostly got surprised now, right? Imagine. Thank you very much, Dr. Chiva. I love it. Look, guys, what Dr. Chiva mentioned here. It is additional. I said A. Very good. It's you got it now, guys? It is additional. Option E is basic. In exam, Dr. Simran, you will have the same confusion. You will be confused like that. That's why you need to read every letter, understand every letter, not just only, right? Okay. There's a question here. We have letter mix and not enough, Dr. Lev. Okay, guys, let's write down this Bedo byte. Sorry, Bedo math. Let's write down this. Okay, this Bedo math. Okay? Okay. Now, guys, have you read the new TG, or actually not necessary to be new TG only? Guys, do you know, have you read somewhere, if you have pre-apical radiolucency on X-ray, you consider it as chronic infection? Have you guys read this somewhere, anywhere at all? Let me check your answer. Yes, yes, very good. Very good. Dr. Leo mentioned yes. Dr. Lev, say yes. Very good, I'm happy. Dr. Simran, yes. Very good. So now that's the right way. So now, because we have pre-apical radiolucency here, so most probably you have infection. Now, let's think about it nicely and easily. If you have infection, should you prescribe antibiotic? Should, if you just generally, do you think every patient with infection, we should prescribe antibiotics? The answer is let me check your answer. No. Thank you very much. The answer is no. Right? If the patient has infection, not necessary to prescribe antibiotics unless there is a delay of treatment. If there is a delay in treatment, in this case, equal to prescribe antibiotics. So now, Bedo math. Make it easy. And by the way, guys, this is going to be the new course. The new course mainly, it's about Bedo math. Okay, Bedo math. Now, periapical radiolucency. Periapical radiolucency equal to infection. And then delayed treatment plus infection up to 24 hours, okay? Plus infection equal to antibiotics. Guys, have you seen this information in TG before or not? Did you read this information TG or not? No. How can Dr. Lev go and open this information? Go and read it now. Okay? Yes. Don't remember? That's okay. I'm sure 100% you have read it before, but you cannot remember it now. That's okay. Okay? Everyone have read it. Everyone has read this information. So it is great then. So now, yes. Therapeutic guidelines, doctor. Therapeutic guidelines. All them both. Yes, even old TG and new TG. Okay, doctor. That was doctor when he said no. Maybe he forgot. Dr. Liv. Dr. Liv, it's page 80. Okay, Dr. Liv. So now, guys, think about it. Think about it right now. Do you think at this stage, after you broke the file, did you really complete the treatment? Are you 100% sure everything nice and clean down there? Did you block all the way down onto the apex? Did you place calcium hydroxide all the way onto the apex? Are you happy with this treatment today? What do you think? Let me check your answer. No, right? Definitely. We're not happy. You're right, Dr. Lev. You're right, Dr. Leo. You're right, Dr. Mariam. Right, Dr. Juvaira. We're not happy because the treatment hasn't completed. I'm not happy. Why, Dr. Nandini? Don't be shocked, Dr. Nandini. Right? Yes. Dr. Nandi say, no, now, okay, no, sad and shocked. Yes, definitely not satisfied, Dr. Simran, right? Not happy, not satisfied with this. True. Great. So guys, now answers antibiotics. I believe this is one of the question, guys. You didn't answer it right, but I have seen some candidates answer it right. Next question. Will you charge the patients for their treatment? Will you charge the patient for today's treatment? Let me check your answer. C Charlie, C Charlie, C Charlie, C Charlie, C Charlie. Everyone say C Charlie. Dr. Melsma A Alpha, C Charlie, C Charlie. E Echo. Now, no charge at all because a complication occurred. Can be right. But you have done work, and then what you did right now, not bad. Like everyone definitely can get into a complication. So whatever you done for treatment today, you can cease charge because you haven't failed yet. At this stage, you haven't failed yet. You're only going to fail if the patient refuses the treatment by you or you cannot do the treatment anymore. In this case, you may need to refund the money back. But at this stage, you haven't failed. You already did a job. There is a complication happening. You will fix this complication next visit. Why not? No charge, not happy with that. Give the patient 50 discount, that is wrong. In clinic, we don't give any discount this way because of complication habits. That's very bad. Not professional at all. Charge appropriately for the treatment complete today. Yes. Yes, you have done treatment. You have an access cavity, you give anesthetic, you spend time, you haven't failed. The secret word here, you have not failed, right? Means you still going to remove the file the next visit. Why not? I can charge the patient for today. The only thing is we may refund the patient if you cannot remove the file, and the patient in this case may need to see a specialist endodontist to remove it for him, so you're gonna pay for this. And sometimes also what happens is we refer the patient to specialist, endodontist, the endodontist remove the file, charge patient, let's say $500, and then you may charge a patient 2,000 altogether, maybe let's say 2,000. In this case, you pay 500 to the specialist and you take 1,500 only. Okay, guys, let me explain this part again because I know everyone say explain it again. So now, let's say I discussed the fees or the charge to the patient from the first visit. 2 grand, 2K. Then I broke a file. By the way, guys, every year I must break at least one file every year. Then I broke a file. In this case, I refer the patient to specialist. Specialist, charge 500 to remove the file. I complete the treatment, all the other visits, and then I get in my pocket 1,500. So now the patient still pay the same amount we agree on that in the beginning, in the start. 500 to the specialist to remove the file, 1,500 for me, altogether 2 grand or 2K, the same amount that I have agreed to the patients. I hope, guys, what I'm saying right now clear to everyone. Okay? Understandable. Thank you very much. Dr. Lev mentioned understandable. That's very good. Dr. Daniel. Yes, but doctor, I don't know how to remove files from canals. Okay, so refer. That's what I'm saying right now. Refer to specialist, and the specialist is gonna remove it for you, and then you can continue the treatment. Either way, finally 500. You can pay 500 and take 2 grants from the patient. That's okay. Or let the patient to pay from his pocket, and then the patient in this case should pay you 1,500 rather than 2 grants. Either way. The second or next scenario, there is a basic periodontal examination score provided here. The patient HbA1c, you know what? Everyone has attended the Tuesday clinical classes will be able to answer all these questions easily. If you have attended the Tuesdays, guys, who's guys attended guys at Tuesday clinical classes? Dr. Lev, yes, Dr. Lev, I see you. I see you don't the best. Dr. Sabik attends. Very good. I'm very proud of you guys. Dr. Shashank, very good. Dr. Debika, very good. Dr. Balija as well. Very good, guys. If you really attend the Tuesday, the Great Tuesday for clinical classes, I always attend all your class. Thank you very much, Dr. Tanvi. It's my pleasure, definitely. Very good, guys. I'm very proud of you. That's a way. Now, that's why you're gonna answer this question right. What is true regarding the basic periodontal examination? Guys, what is true, guys, regarding this examination? Basic periodontal examination. A, B, C, D, or E? A, very good. Perfect. You guys doing great. Bro, we are active and funny. Yes, I know. And that's what I like about you guys. You make the journey very interesting. That's why I love our champions. They are special. We lucky to have you guys always. Our champions always they have different qualities, different features, which I really appreciate it. They're always nice with big hearts and dedicated, and that's why we always guys having you pass the exam. You always the leaders. A. I'm very proud. I'm very happy. Last question, Dr. Karen. I'm not quite sure. I need to get back and check it for you. C. No, the last question is okay. C then. The candidate mentioned C, okay? No problem. Now, perfect. The basic periodontal examination is a scoring tool and not diagnostic. You cannot diagnose a condition like that's what the way I have discussed yesterday. When I say about grading or about staging, you cannot reach the staging and grading with proper classification or proper diagnosis based on the basic periodontal examination. Why? Because in basic periodontal examination, the only thing you check is a periodontal pocket only. You don't check mobility. You don't check furcation involvement. You don't check deviation of the teeth. You don't check the amount of bone. You don't check gingival recession. You don't check all the stuff. So how come without all the stuff you can get diagnosis? No, it's not diagnostic, but it is the easiest, quickest tool and test we do to give us good idea about what gonna happen later, what exactly we need to do in the case. So the answer is A alpha. Next question. What is the correct periodontal stage for this patient? Guys, what think are the answer for this? So what do you think the answer for this one? A, B, or C, or D? Let me check your answer. Which stage? Very good. I'm very proud of you, D delta. What's your justification, guys? Why it's D delta? What's your justification? Why D delta? C, Dr. Ash, no. Very good. More than 50% of the bone. Not just very good and mobility. I love it, Dr. Luciano. That's why it's called 80. Guys, think about it clinically. Look at the X-ray. Okay, now, easy way. Very easy way. Very easy way. Okay, don't confuse yourself. Now, if you have, forget about the pocket depth because pocket depth is just above more than 6 millimeter. Let's even include pocket depth. If you have a pocket depth more than 6 equal to or more than 6 millimeter, means you either to be stage 3 or stage 4. Look at the amount of the bone. There is no bone. More than 1/3. More than mid of the roots, the bone resorption. Now, what else? If you have mobility, think about this. If you have mobility, grade 2 or 3, is it going to be stage 3 or stage 4? Mobility, the mobility, grade 2 or grade 3. Which stage going to be? Thank you very much. Smart. Stage 4. Thank you. Now, look at the X-ray. Do you think the three teeth together, next to each others, do you think they are mobile or not? They have no bone. Do you think these teeth mobile or not? No bone. So in this case, from the X-ray, however, if it's not mentioned in this, I'm not sure if it's mentioned or not, but based on the X-ray itself, it is stage 4 because I have either grade 2, grade 3, grade 2 or grade 3 mobility. I hope, guys, you learned something new today. Our candidate, they know this stuff already. Anyone who's attended the session from outside the academy, I'm sure that could be the first time to have this concept by this way. Okay? So now we are talking about stage 4. Next. What is the correct periodontal grade for this patient? What do you think the answer, guys, for this? Let me check your answer. Grade C, perfect. Grade C, perfect. I love it. Grade C, perfect. Why? I need justification. Why? Don't tell me only grade C or stage 4, but I love H. Very good. HbA1c 10%. Thank you very much. Mean uncontrolled diabetic patient. Means the patient has uncontrolled diabetes. And we understand this, right? If the patient has no diabetes, no diabetes, right? Means grade A. Diabetes, right? And controlled means grade B. Diabetes and uncontrolled diabetes means grade C. Thank you. So now it's a grade C. Definitely, the amount of bone resorption can be another reason. But somehow, we rely on modifiers easy for us to pass the exam than to calculate the amount of bone loss. By the way, guys, people attended the clinical class yesterday. In this case, chronic case? Is it chronic periodontitis case? Let's see, guys, I know you're smart, but I know how much you got from Tuesday clinical session. By the way, guys, Tuesday clinical sessions happens every Tuesday. I do session every Tuesday, which is clinical scenarios like this to discuss it together. Very good. I love this. No, it's not chronic. Why not chronic? Rapid progress. Very good. Rapidly progressive periodontitis. Right? It's not slow growth. Very good. It is rapid. Can we say the word acute? Can we say acute periodontitis? There is any condition, there is any periodontal condition called acute periodontitis? No. Even chronic these days not existing. Based on the new classification, not existing. I'm very guys happy and proud of you. Now the answer C, Charlie. You start guys doing great now. Get closer to the exam. Getting closer to the exam, you start doing great. You decided to extract even I tell you something. This also. Okay, that's okay. You tell me first. What is the answer for this? You decided to extract 5 hopeless teeth. What is a new periodontal stage? D delta. Right? Very good. I'm very happy. D delta. Which is stage 4. Exactly as we mentioned before. Why? Because when you extract more than 4 teeth, you are now stage 4 and you're extracting 5 teeth. And by the way, you can take this as a reference for the second question about staging, the question we asked about staging. Because if the same patient you plan to extract 5 teeth, it means straightforward, it is stage 4 from the beginning. So this case is stage 4 from the beginning. So you can use this information to help you to decide on the staging for the other questions. We actually discussed, I think it was question 7, maybe. Yes, question 7. So question 9 is a reference also for question 4. So now it's stage 4 or stage 5. Okay. let's move to the next question. The grade. Guys, what do you think about grading here? What is the right answer for grading? Let me check your answer. B bravo, very good. B bravo, grade B. Why grade B? Because we just mentioned it now, right? When it's a grade B, you perfect. Why grade B? Because actually, right? Because diabetes is controlled now. What is update periodontal grade for after 9 months? Because after 9 months, you get less than 7% when HbA1c less than 7% means patient blood glucose level is controlled, and a patient with controlled diabetes is grade B. Perfect. Next scenario. What do you think, guys, the answer for this scenario? Read the scenario properly to find out the right answer. C Charlie. Everyone, guys, goes to C Charlie, right? That's very good then. If your answer C Charlie, it means like you're doing great. Guys, everyone, guys, happy with C Charlie? I agree on this. C Charlie. Mobility and periapical X-ray. Why? Let's go ahead with every single option from here. Now, Evan is a 4-year-old boy brought to your clinic by his mother, Mrs. Susan, after falling yesterday and chipping his front teeth. Evan reports pain when biting. That's normal after trauma. And his mother discarded the broken fragment thinking they were useless. Although she describes Evan as usually hyperactive, he appears unusually quiet today. On examination, you note chipped upper primary incisors. You proceed with investigation and discuss management. Now, which investigation will you perform? Percussion. No, really, that's too much for patient. Too much. For a child with pain and trauma, you're going to traumatize the tooth. That's not good at all. So don't do percussion. So now, option A is wrong because of percussion. Don't give extra trauma for the child. I know it could be mentioned in some whatever, like this is when it's mild, and you cannot find the which tooth has involved in the situation or involved in trauma. But easily, I can tell there's two teeth actually involved. So percussion is it's really traumatizing. Now, percussion, traumatizing. So option A, wrong. Option D, wrong. Visual inspection, I love it. I love visual inspection. But what? You already had a photograph, so you don't need visual inspection anymore. What about OPG? Very good option. By the way, I would rather go with OPG sometimes, right, in trauma cases, but the only reason is OPG somehow will not be the best in this case. Why? Because they are anterior teeth, front teeth, and sometimes or most of the times OPG show the front teeth blurry. Why? Because the focal trough, right? So there's a focal trough which actually make it hard for the OPG to show proper sharpness or good quality for anterior teeth. That's why OPG is not the best here. So any option of OPG gun, mobility gun, the only one option left in now is C Charlie, mobility and periapical X-ray. Okay, which device? This is guys something clinical for you. Which device you're going to use to take the periapical X-ray? Let's see now, guys. How is your clinical concepts? The clinical guys, this actually can be a question exam because it's clinical situation. All the exam about what we discuss right now. Finger? No. Okay, I will say yes. Which finger? Ren XCP? No. See, guys, these are the question you're gonna get in exam. Patient holder or crocodile? Crocodile? Do you have crocodile work with you in the practice? What's a crocodile? Crocodile? I actually have read a crocodile. Film holder? Which film holder? Periapic X-ray holder? No. Patient finger? Not really. Not in Australia. These are the tricks in exam. Cotton roll and ring? Maybe, like somehow you close, but still no. His mother, poor his mother then. She'll get radiation then. Thank you very much. Why? Which film holder? Thank you. Please, guys, everyone love this. I will love it by myself. This option. How I can love it. This one. Give it big heart. He cannot bite onto holder. Totally agree. The mother finger? No. Okay. Yes, they have okay, maybe a pig crocodile. No. Okay, guys. I tell you what we use in this case. Because so far, maybe I haven't checked, guys, if you read or not. His tongue, how can we contrast that? Rug? No. Okay, guys. We have, guys, have you heard before something called snap ray? Snap ray device. By the way, it's Australian invention. Have you heard about the snap ray before? Yes, Dr. Fijali, I'm very happy you have heard about it. And this is, guys, what we use in these cases. Snap ray. Okay, you want me to show it to you? I will show it to you. No, dense finger, no. Guys, in Australia, it's not allowed to hold the X-ray with a finger. Why? Why? Because actually, you're gonna give extra unnecessary radiation to the finger. We don't like it. In this case, we go with a snap ray. Yes, everyone mentioned Javaira, she write it right down. So, Dr. Sangita, let me guys show it to you. Give me a second. See, guys, how interesting is dentistry? And by the way, this is Australian invention. We love it here in Australia. Okay, guys, this is a snap ray. Guys, can you see, guys, a snap ray? You actually put the film in this side, and then anyone now can hold the film like this one. Anyone now can hold the film. Why? Because the cone will be only, the X-ray beams will be only focused on the film, but the finger will be here. So the finger will be away from radiation. And then the patient doesn't need to bite. No need to bite. Because in this case, you're going to hold it by your hand. We have two options. The snap ray is really very smart device. If an adult and then there is no trauma, they can bite. If there is a trauma and the patient cannot bite to not hurt the tooth, now the mom or the dental assistant or even the child can hold it. But we prefer dental assistant, maybe mom in this case, but not the finger. Maybe mom. Actually, the child. That's okay. You can ask the child just to keep it. And anyway, we'll work fine most of the time. We'll be okay. The child will know how to manage it and just keep his hand just in one position, and that things can be done in the same way. Okay? But not the finger. Don't even expose the mom. The child can be fine. Guys, is that guys new to you? This snap ray is the first time, guys, you know about the snap ray? You call it snapper? Okay, very good. Yes, we sometimes call it snapper easy. Yes, snapper, yes. Very good, guys. I'm very happy. Very good. So this is, guys, what we need to know now. That's what exactly we do. Yes, it's gonna bite the people. It's a crocodile. It's gonna bite the people, right? Not used before, didn't know the original name of it? Yes, that's the one. That's how we call it now. So now, guys, answer C, Charlie. Next question. One thing, guys, answer next question. For baby teeth, do we prefer composite resin or resin modified GIC for baby teeth? D delta, please, guys, okay? D delta, please. No B Bravo, D delta. No B Bravo, Dr. Amreen. D delta, not A Alpha, Doctor. D delta. I see up to 70% in now. They mentioned D. They answered D. About 30% is A alpha. Yes. Easy concept. Baby teeth. The first restoration. Guys, you'll find this in Bedo Bites. In Bedo Bites and Cake. The first choice of restoration for kids is resin modified GIC. And for adult, right, is composed restoration. Can I put temporary crown in this one? Why? It is big enough. You don't need a temporary crown. Why temporary? Zirconia is very expensive option. Zirconia very expensive. Temporary crown? Why temporary crown? Things are fine. So guys, reason modified GIC. Question 10 was actually, what is updated periodontal grade for the patient after? Yeah, we mentioned grade B, right? Yes. So next, C, next, D, next. What age group is most prone to traumatic dental injuries? If you have read the trauma guidelines, you will know the right answer in this for this one. If you have read trauma guidelines, you will know the right answer. The right answer, you're right, guys. Yes, C, Charlie. Easy now for you, right? C, Charlie. C, Charlie. C, Charlie. Very good. 3 to 6 years old. Very good. You're right. So now C, Charlie. Yes, 2 to 6 year old is the best. It's in trauma guidelines. Easy, guys. You can find it there. You notice facial bruises and a healing scar on Evan's arm. What you do next? So, guys, what do you think we'll do? So the question asks about what you do next. Like easy, simple step you're gonna do. Not something. Don't take any irreversible decision in these cases. You need to collect information in the first instance as much as you can. So who's guys gonna give you the right information? The parents. Ask the parents about the cause of this bruises and scars. They may had maybe a fall, maybe has happened during the fall, right? He may, he's a child, maybe had some accident has happened to him recently, and then he went to GP, and then GP has diagnosed him. So again, don't take a decision, a, a quick or rapid decision, fast decision to do. But some people answered A, alpha. I know now why this. And then B, bravo, it's not. Don't do this, it's too quick. D delta and B, they are the same. B has excluded D, exclusion technique. B has excluded D, exclusion technique. Take a photograph. You already took a photograph and the continue treatment without asking. No, we must ask. So the answer C. Someone now may ask me, daughter, why not A alpha? I see, guys, you saying A alpha. Tell you why not A alpha? It's not A alpha because the question asks about what you do next. So one of your documents, or to document the injuries, should be after you ask the parents. So first you need to ask the parents, then document. So now what do you next? Order is very important for the exam. You must follow order. All these tricks, we're going to discuss all these tricks in the next course because we're getting to the exam. So all these tricks will be more clear to you. So C and then A. Next question. A or B or C or D. Next question. Again, trauma guidelines. Again, trauma guidelines, easy concept. I see guys who give me question for answer for D and A. D. Most of you guys go with D. Thank you, Dr. Simran, very much. Please, guys, everyone likes Dr. Simran's option. Please, guys, everyone likes Dr. Simran's, please. Dr. Simran said, question says accept. So now if you go on with D, that's not accept. Sorry. Yes, it should be D. Because the question's not A. So the answer not A, right? Answer not A if this is the same question. The question asks except. So now the mother asks, what should I do next to help Ivan? All the following are correct except clean the area with soft brush and apply alcohol-free chloroxidine to 0.12% using cotton swab. That's correct. Check this in trauma guidelines. So this is not the answer. Take care when eating to avoid further trauma. This is correct, not the right answer. Because the question asks except. Watch for complications such as swelling or mobility. This is correct. So A and B and C, all of them correct. D delta is incorrect because the question say except. This is only except. It's not normal for kids to fall. It is hard to prevent, and it's not hard to prevent injuries. We need to look after the kids. We must be caring and we must look after the kids. So option D is incorrect, but A is correct, B is correct, C incorrect, and D is the right answer because it's incorrect. What do you guys answer for this question? Which statement is not? Please, guys, be careful from this stuff like the word not. Except, not, unless. All these phrases, we're gonna discuss it from the next stage, from the next course, right? Because we need to focus in this point very much because the next course will be mainly about questions. We're gonna go comprehensive with materials and stuff. Oh, I would just right now say the secrets, but not today, right? What is the answer? B bravo, okay. B bravo, B bravo. Very good. Why is B bravo? Yes, today, not today, not today, next time, maybe on. Ah, by the way, guys, let me just now put a post for you and then tell me, do you want to really have a session Friday? I'm not quite sure because I'm trying to do my best to help you, but not quite sure if this is gonna be good or not. I need to check my time as well. I need to check my time as well. Let me check this. Okay. Okay, guys, I'm posting right now here. To have the gold standard. It's, guys, a gold standard session. Again, I'm not quite sure how many of you guys will be available for this session. And then I always do session if you are available. So if you're busy, right? If you're busy, just if you can't do it, comment. So if we have enough, so if there is 150 candidates, We will do it. Okay? So please, guys, let me know then. I will post right now. Gold standard class this Friday. Okay. Guys, I posted already for it. I posted in our part one group, okay? In the public group. Based on your comments, how many you are? If I see about 150 last time, it was about 140, so I thought it's not really good because 150 is a minimum, right? Okay, now B is the right answer. An absolute contraindication patients taking medication for high blood pressure. Why? It's not an absolute. We still can provide local anesthetic with adrenaline for patient with blood pressure as long as it's controlled. So okay, control blood pressure. Which ASA category? We have guys who need to read something called ASA. Which category is controlled blood pressure? Let me check, guys, if you know it. I'm sure you know because we discussed this before. Thank you very much, doctor. ASA 2. ASA 2. I'm very happy. Okay, so in ASA 2, can we provide adrenaline? Yes. What about uncontrolled diabetic patient? Sorry, uncontrolled hypertensive patient. Which ASA? On uncontrolled hypertensive patient. It will be ASA 3. Can you provide adrenaline for ASA 3 category? No. Easy now? Thank you very much, Dr. Raza and Dr. Simran, every one of you guys. Perfect. Now this question is easy to understand. I'm happy. Question 2. While administering LA, Mr. Harris becomes sweaty, calming, dizzy, and lose consciousness. Look at here. Patient has no had any history of heart failure before. Just he got stressed a little. He just got stressed a little. And that's why he loses consciousness. So what is the right answer? Very good, C. Charlie. Very smart. The right answer, C. Charlie. Because the question is about what will you do first? C. Charlie. C first, A second. C first, A second. Tricky, right? So C first, A second. Mr. Harris regains consciousness after you recline the chair. What is your provisional diagnosis? A patient who just felt clumsy, cold, lost his consciousness. He has no any history of heart failure. This only happening when you give him anesthetic. Then once you reclined in the dental chair, he regained his consciousness. Vasovagal syncope. Easy. B bravo. Very good. Very easy, right? Now it's easy. Vasovagal syncope. Now, Mr. Arnold says he feels okay now. What will you care? How will you care for him today? Should you complete the extraction? Now you care about your pocket. If you go into extraction today, means you care about your pocket. You don't care about the patient, right? So option A, you care about the pocket. Option C, you care about the pocket. We still have option B valid and option D valid. Postpone extraction and discharge immediately. Wrong. You cannot discharge him immediately. You need to wait for some times until check on him. So the best way is consider referring for medical evaluation. Do you think that we should refer every patient with vasovagal attack for medical evaluation? Do you think so? Should we refer every single patient after vasovagal attack for medical evaluation? No. But why have we decided in the practice today to refer this patient for medical evaluation? Because patient is old. Patient is old. That's why I'm very proud of you. Everyone mentioned because patient is old. I'm very happy. So the answer D delta. Next question. Mr. Harris refuses extraction today and will return next week. What you prescribe now? What will you prescribe? Same concept we have discussed the area. There is swelling, means there is infection. It has mentioned here, here's an abscess or something, periodontal abscess, I believe. And periodontal abscess is an infection. In this case, antibiotics is must. Patient has allergies to penicillin. So that's why clindamycin. A alpha doesn't have antibiotics. Wrong. C Charlie has IV. Why IV? It just a periodontal abscess, gingival abscess. So IV only when there is spreading odontogenic infection with severe feature. Yes, periodontal abscess. So option C is wrong. Siloxib is good. 12 hours. Paracetamol is good. Clindamycin. Now Siloxib. Anything in the scenario may contraindicate ibuprofen. Any medical condition? Do you think there is any medical condition that can contraindicate ibuprofen? Thank you very much. B or which one? Old age? Old age. Very good. So now which one can be safer? Siloxib? Siloxib will be a little bit safer or ibuprofen safer? ACE inhibitors. And then actually the medicine is inhibitor. And also, so what do you think right now? Is it the answer? Is it B? Answer. Is it B or D delta? Which one? Or B Bravo or A alpha? Definitely B Bravo. Paracetamol, then clindamycin. Why? Because the pain actually is mild pain, no severe pain. That's why B Bravo is the best answer. Why? Because it's a mild type of pain, mild pain. That's why you don't need for ibuprofen, you don't need for Siloxib. When you have a mild pain, we use paracetamol. When we have a moderate pain, we use paracetamol plus ibuprofen. When there is a severe pain, we use paracetamol plus paracetamol like salt. It's in every recipe, seems like. Paracetamol should be in for every pain then. So answer is B, Bravo. Next question. What think guys for answer question 1? Very tricky question. Very tricky question. Wow, you got it right as well. B, Bravo. I told you guys, very smart. Occlusal splint. Why guys occlusal splint? That's really very good. Gold standard for bruxism. Very good. I'm very happy. Yes, because bruxism. Patient has bruxism. Definitely not porcelain veneers. Some people, they may think about refer to prosthodontist. No, first step is to give a occlusal splint immediately in the same visit if you have the device, if you have the machine. Otherwise, after you do the occlusal splint, you can refer to prosthodontist. A is wrong. C, composed restoration, that's not now, not at this stage. Endodontic treatment for worn out teeth, that's aggressive. Refer to prosthodontist after B, so B and then E. Question 2. Which one of the following diagnosis step is most essential? Very essential, very important. MRI, not really. Sensibility test, not really. Occlusal analysis, yes, because we need to check the occlusion, how it is. With mounted study models, very good, because without this, you cannot tell how severe is the condition. And then you cannot decide on the proper management. But registration, this is only for prosthetic work. Occlusal analysis, no, definitely B is much better than C. But registration, you just do it when you do, that could be helpful for treatment, maybe, but occlusal, but mounted study cost, study model is more important. Sensibility, not really. MRI, not really. Answer is B, bruv. Now, what is diagnosed of cervical lesion? Patient has bruxism, right? He has atresia. Atresia because of bruxism. Bruxism result in abfraction. Bruxism results in abfraction. Bruxism doesn't result in abrasion. Bruxism doesn't result in erosion. Bruxism, too much forces on the teeth. These will flex at the cervical area, so it will result in abfraction. That's not caries. Caries looks different. Which one of the following statement is not correct regarding the Botox, guys, in dental practice? Not correct. All of these correct, except only one of these options not correct. Very, very hard question. Really very hard question. B bravo. The answer I can see right now is B bravo. D delta. B bravo. D delta. E echo. C Charlie. E echo. C Charlie. D delta. C Charlie. D delta. E echo. D delta. Okay, guys, let me tell you the answer then. The answer is D delta. Botox doesn't cure TMJ disorder. Definitely it doesn't cure. It can, look, it doesn't work. It doesn't work in Australia. Botox, by the way, guys, it doesn't work for TMJ. It's not reported in Australia that Botox used to cure TMJ. It's not. It is actually static material. It can be filler somehow, but they found out some people's TMJ disorder, they relax the muscle. So that's okay. It doesn't harm. Let's use it then. That's why it is off-label. Off-label means off-label. Guys, what do you think, guys? What does it mean, guys, by off-label? When we say this medicine is off-label, what does it mean? In Australia, we say to the medicine, this is off-label, like Botox. What does it mean? Thank you very much, Dr. Luciano. I love this. Look, guys, big heart to Dr. Luciano then. Means you are using it for something else. You are using it for something else, yes. Not less than TGA. Correct as well. That's why I give you Dr. Tanvir big heart. But yes, it means for this case, Botox is being labeled in Australia for static, for fillers, not labeled for TMJ. However, you can use it for TMJ as long as it does not harm. So that's a word off label. So now the responsibility on you. So A is correct, B is correct, C is correct. The effect of the Botox is temporary, true. But this is the right answer. Dentist may delegate. No, dentist cannot delegate the injection of the Botox. No, you cannot. D is the right answer. Guys, what is guys' answer for this question? Easy, right? This one, I would say, no, really, I have seen some people, they do it wrong. People said coffee stains, sclerotic dentin, nicotine stains, and this stuff. So, guys, what's the right answer? And also I see question here from Dr. Walija. Why not MRI? He seems to have TMJ issue. Doctor, the main question, make it easy and simple. The whole case is about paroxysm and attrition. It's not about TMJ disorder mainly. At this stage, it's not about TMJ itself. We are looking at the teeth itself. Okay? So what is the right answer? C. Okay, let me check. The right answer is C, tertiary dentin. Not second. Secondary is normal. It's a physiologic dentin. Everyone in the life should have secondary dentin. But tertiary dentin happens in the cases like attrition. The slow traumatic is slow, not fast. Sclerotic can happen in the fast, like someone bash you in the face and then they hit the tooth badly, and sclerotic can happen. But tertiary happens when there is there is a slow irritant, like slow, like attrition. It happens on long time. So answer, guys, C, Charlie. Guys, do you know exactly when we're gonna start the new course? Do you know which day? Are you excited for it? And by the way, he reports ear pain that is worse in the morning and improve throughout the day. This is not TMJ disorder. There's a muscle issues, muscle. Not TMJ. It's a muscle only. Muscle involved in this. So you don't need actually, if you're going to check this question, because the question actually may bother you still, you not be able to sleep tonight for MRI, right? Okay, let's say MRI is good. I would agree on this. Why sensibility test is good then? And do you think occlusal analysis with mount study models will be better, or MRI and sensibility test? Definitely, B Bravo is better. And just the muscle, you can check it by palpation. Let me guys check the score. How much is the score? Not quite sure, guys, how much the result can be. By the way, guys, let me check that every one of you aware about when the new course starts, right? Monday? No, it's not essential, Dr. Arshan, not essential, no. Monday, yes, it's Monday. So, guys, that is great then. So, guys, you're right. It's Monday, Dr. Abdul Kader. Yeah, next week, Monday, which is 8th December, we're going to start the new course. Yes, Dr. Melzman, it's Monday. Dr. Simran, Monday, Dr. Channel. Niproxism, yes. Patient takes another mock on any topic. Okay. Yep, we can do this. Let's check the result, guys. How much did I score or we score together? Oh, there is no score. Why this? There is no score. Yes, we can do this. Okay, guys. No, we don't need to check. No, we don't primary or mainly. No, not on vitality test. No. No vitality test. Okay. No, guys. Okay. Not the primary. Maybe later on. It's Monday, right? Very good. Eights. It's not nines. It's eights. Monday, eights. Okay, guys. So yes, to conclude, that was, guys, great. Right? I would say. Oh, now I got the answer. There is one question, guys. I mark it wrong. What was this question? Guys, remember, guys, which question I mark it wrong? Anyway, there's one question. I normally do this. I mark one question wrong. Okay. So, guys, we are now aware about this one. Monday will be the new mock. And then Friday, if you're really happy to do this, we can do it on Friday if you like. Thank you very much, guys. I was very happy to have all of you today. Thank you very much. And then see you then on Friday or Monday. Depends on how many candidates are available for Monday, for Friday session. If we have, if I see there is enough candidates able to attend the session, so I will do it. If not enough candidates, so definitely I will not do it, and then we stick to Monday. Thank you very much, you guys. Have a great night, everyone of you. I was very happy to have all of you today, guys. Thank you very much. Thank you very much, you guys. Thank you very much. Have a great night, everyone of you guys. Doctor, if you still have any question, we can discuss all the question then on Telegram group, okay? On our private Telegram group. If there is any question, guys, we'll discuss it. We can discuss this in all together on our Telegram group so everyone can get benefit as well there. Okay, guys? Thank you very much, you guys. Have a great night. Thank you very much, you guys. Bye bye. Bye. Thank you, guys. Bye bye. Bye.